Hello, I'm Dr. Kevin Kaplan, an orthopedic surgeon at the Jacksonville Orthopedic Institute in Jacksonville, Florida. I'm one of the team physicians for the Jacksonville Jaguars and the head team physician for the Jacksonville Sharks. I specialize in injuries of the shoulder, elbow, hip, and knee. Today we're going to be speaking about injuries around the knee. I see a lot of patients with a lot of different complaints of pain in the knee, and there are a lot of injuries that can cause pain in the knee. We're going to talk a little bit about cartilage injuries, meniscus injuries, ligament injuries, and tendon injuries. But before we get into our discussion about these types of injuries, I want to explain a little bit of the anatomy of the knee so you can get an idea of what it is that I'm looking for. So I brought a model for us to look at. This is the bone of the femur, all right, which is the thigh bone, and the bone on the shin, which is called the tibia bone. All the muscles have been removed from this model, so all we're really looking at are the ligaments and the tendons and the bones. So the way that the bones are connected to each other are through ligaments. Muscles are connected to bone through tendons. So the main tendon that runs in the front of the knee is called the quadriceps tendon. And that starts way up in the thigh, which we don't see, and turns into a tendon and then runs over to the other bone in the knee, which is called the patella. And this is what most people call the kneecap. The quadriceps tendon runs over the kneecap or the patella and then turns into the patellar tendon to attach to the front of the tibia. And what that does, it allows you to straighten your knee and bend your knee. So in other words, it enables you to walk. Without a patellar tendon or a quadriceps tendon, you'd have a lot of difficulty in even straightening your leg or getting up from a seated position. When you look at the other structures around the knee on this model, those are the ligaments. So there are two main ligaments on the inside part, which we refer to as the medial part of the knee, and there's one ligament on the outside part, which is the lateral side of the knee. The ligament on the inner part of the knee is called the medial collateral ligament. That goes from the femur bone here to the tibia bone here and helps to prevent the knee from going outwards, which is what we call valgus. The other ligament in the knee on the outside is called the lateral collateral ligament, also starting from the femur bone, and it attaches to this other bone, which is called the fibula bone. That's the bone that runs on the outside part of your leg. That helps to prevent the knee from going into varus, or going in this direction. There are two other main ligaments that are on the inner part of the knee, and those are referred to as the cruciate ligaments. Cruciate means crossed. So these two ligaments in the body actually cross each other. One in the front is called the anterior cruciate ligament, which is here, and that prevents the shin bone or the tibia from going forward on the femur. The other ligament, which is in the back of the knee, is called the posterior cruciate ligament, and it serves to prevent the tibia from going backwards on the femur. The other important structures to consider in the knee are the cartilage, all right, and that's depicted in this model in blue. The cartilage is like a cushion. It's almost like a Teflon coating that covers the surface of pretty much every bone in your body. It allows the knee joint to run smoothly as you bend, twist, and turn. The other type of cartilage in the knee is called the meniscus. The meniscus is this C-shaped structure on the inner part of the knee. It's both on the inside and outside part of the knee, and it is also like a shock absorber. So as you walk and pound and turn and twist, this meniscus prevents the cartilage on the ends of the bones from contacting each other. So those are the main anatomic structures of the knee. So what are the types of injuries you can have? The most common injury I see in my office is a tear of the meniscus cartilage. So this cartilage here, this cartilage cushion, can be torn. If it's torn, then it's almost a mechanical irritation to the bone when you turn and pivot and twist. And how that manifests in patients is by swelling. A lot of patients will describe a sensation of a buckling of their knee, or their knee will give way. These can be treated conservatively in physical therapy, or we can go in arthroscopically and actually repair or trim the part of the meniscus that's torn. Other injuries that can happen around the knee are cartilage wear on the end of the bone. So instead of the cartilage looking smooth like this, you get a breakdown of the cartilage. Eventually, if enough of the cartilage breaks down, you will have no cartilage covering and you will have bone exposed. That is the process of arthritis. So the cartilage wearing down, the bone being exposed, and bone doesn't like being stressed. So if the bone is exposed, it will then create new bone. and that's what's called an osteophyte or a bone spur. So that entire process is the process of chondromalacia or cartilage wear in early arthritis. The other injuries of the knee that we talked about were ligament injuries. The medial collateral ligament is very commonly torn in skiers or football players who make a sudden movement and their leg gets forced in a direction like this. Most medial collateral ligament injuries can be treated conservatively with braces and with physical therapy. Very similarly, an isolated tear to the posterior cruciate ligament, which is the ligament in the back, can also be treated conservatively with a period of bracing and physical therapy. Anterior cruciate ligaments, unfortunately, is a ligament that's inside the knee joint and surrounded by the joint fluid. It cannot be treated conservatively. In other words, it won't fix itself. Some people can survive without an anterior cruciate ligament if they aren't doing a lot of twisting, turning, and pivoting type sports. You could put a brace on and to make sure that the patient's leg doesn't give out. But the thing that's very concerning with an ACL injury is if you continue to buckle the knee, in other words, if the knee continues to pivot out, then the cartilage that we talked about before could be severely damaged.